regarding residual risk in atrial fibrillation, I think this is a very important topic because it's the typical what we call the failure. No patient think she or he is safe on treatment, everything is going well, and then we realize that he or she is coming to us with a stroke. So what we try to understand first is if there is really an adherence, because sometimes they tell you, oh God, yes, I did it, I took the drug, and then you discover that they took the drug which was supposed to be taken twice daily, only once daily. So they say, okay, here we have a reason. And then if everything is perfect, they adhere and so on, then you look of the pattern of the stroke. And for example, 30% of these patients have not cardioembolic stroke. So you have to evaluate the global risk profile of these patients, because if they have, for example, lacuna stroke, then you have to think about not well controlled hypertension, or sometimes these patients have dyslipidemia, so they're not well treated, diabetes. And for example, now we see a lot of new treatment option in diabetes and hyperlipidemia that we didn't have in the past, so we can propose them some more better treatment, so to lower the LDL and so. Or sometimes it's really, you see it's a pattern of a cardioembolic stroke, and then you have to think how to optimize better the treatment. The workup is first of all, you have the imaging. You see that this patient had a stroke, and then, as I said before, you look at the pattern of the stroke. If it's you distinguish if you have a typical cortical stroke, and then sometimes you evidence this by CT or even better by MRI, because you can see also the different spots, especially if there is embolization. And then this is for the imaging and the let's say the impact pattern. And then you do all the workup, because you have to recontrol the carotid, because maybe this patient had 50% of carotid stenosis. And in the meantime, this carotid plaque grew, and then now they need to be operated. Sometimes with some even, let's say, valves which are not leading which do not need operation, but they can have some infections. So you have to look if there are any kind of endocarditis. You have to look at let's say, the blood examination. As I said before, you have to look at the lipid profile, sugar profile. So it's a lot of workup that you should do, such as doing a workup for, let's say, first cardioembolic stroke.